So thanks for tuning in to the second of the weekly coronavirus video blogs. As I mentioned last week, these weekly video blogs, which are a bit shorter, are aimed to reinforce some of the written information that we're sharing really almost on a daily basis, because we want to make sure that the key messages and the really important updates you're receiving either in writing or via this video blog. So there'll be reinforcing information you've already had, or giving you early warnings to information which we're about to send out. So like me and 27 million other people, I'm sure you tuned in to listen to the Prime Minister earlier in the week describing some more stringent social distancing measures that are being put in place across the country. So in particular, that involves advising people who can work from home and to stay at home to do so for at least the next 3 weeks. Now obviously across the organisation, because we're a patient care organisation, that's not entirely possible for every member of staff. So we're doing everything we can to enable as many people as possible to comply fully with the new guidelines. So for teams that don't have direct patient contact and perhaps provide some more back office support, on a team by team basis, managers have worked with them to ensure that provisions have been made to enable them to fulfil either all or a significant part of their roles remotely from home. So an example might includes the HR team. So the HR team are working remotely away from the Denton head office, but all of whom have access to the systems, files and folders here at head office, and are working through the same volume of work and the same work they would were they based here in Denton. Any calls to the head office team, to the HR team, are being taken by Holly Jones, our Head of People Services, and Holly's ensuring that a member of the team or herself will deal with those queries directly. So you should receive a prompt and timely reply to any of those queries just in the same way as you would were they based here. We're doing all we can to try to support our clinical staff, even if they are having direct patient contact. So as I mentioned last week, we've purchased many new laptops, and the IT team's been working incredibly hard over the last week to configure those and make them available for as many clinical and non-clinical staff to access the organisation and provide care and support our patient-facing services remotely where possible. And our IT team, even though some of the IT team are not necessarily here on site in Denton, we've created a new IT helpline. So that number's 0161 337 3461. So if you are working in one of our services, have an IT query, ring that number and a member of the team will take the call and ensure that that query is dealt with remotely or by one of the team that are based at Denton on that given day. So one new piece of guidance that I want to draw your attention to that's been issued this week nationally is some additional information regarding what are classified as extremely vulnerable high-risk patients. So these are patients that fall into a number of high-risk categories who are deemed to be at particular risk of, if contracting COVID-19, have been extremely poorly and very likely requiring hospital admission and being generally extremely unwell. So the guidance asks for those people who should have been contacted by now via a letter from your own GP practice to go home and what's known as shield, which means to separate yourself from pretty much any face-to-face contact for at least 12 weeks to really protect yourself from the risk of contracting COVID-19. So there are a number of people who I'm aware of in the organisation that fall into those categories who regardless of that, have expressed through a sheer commitment to the organisation and to patients to want to remain at work and continue to do their job and feel as though they want to continue to contribute, which is incredible commitment. What we've said to those people is because of the levels of risk that the virus poses to them, that we also have to take some social responsibility for ensuring that any of our staff that the risk of them contracting is minimised, so that if they get poorly, they don't occupy hospital capacity, which we know is one of the biggest concerns across the country. So even if you are in one of those high risk groups and you feel that you want to continue to come into work, we will advise you to go home for the period of time that's specified. Nevertheless, we'll do all we can to ensure that you can continue to work where possible, particularly if you're a clinician who can either dial into the telephone system or work remotely via a laptop. We'll do all we can to ensure that you can continue to contribute. So as the situation's changing on a daily basis, it's presenting constant challenges for individual staff and also for the workforce as a whole. So we're trying to keep up with those by updating and reviewing all our policies, particularly those that affect staff that are absent from work, either through illness unrelated to coronavirus, illness related to coronavirus, or self-isolation due to a member of the household being poorly, or if you fall into one of those very high risk categories that I mentioned a bit earlier. So we've updated some hopefully easy to read, simple guidelines that have been issued this week on absence reporting and pay for a whole range of category of staff dependent upon your circumstances. So please do read those guidelines, and if you've got any queries, then please contact either HR or your line manager. I just want to pick out a couple of categories. So people who are self-isolating but don't have symptoms, but are doing so because a member of their household has symptoms. So your entitlement is to receive statutory sick pay for that period of self-isolation if you're not able to fulfil your role remotely at home. So if you are able to fulfil your role at home while you're self-isolating, then you'll continue to receive your normal pay. If you're unable to, and you would be entitled to statutory sick pay, then we would still ask you to liaise with your manager about other alternatives as to how you can mitigate any loss of income through only receiving SSP. And that might include, for instance, agreeing to make up some of those lost hours when you return to work after a period of self-isolation. And a second category of people I wanted just to highlight were those people who do fall into that highly vulnerable at-risk group, who are being advised to go home and stay at home and shield for in excess of 12 weeks. So obviously the impact on people's income potentially is very, very significant. Nationally, organisations aren't obliged to pay for the salaries of those people while they're off work. As an organisation, we are absolutely committed to supporting all our staff. So we don't want to add to the burden, which obviously is significant already for those people. So we're committing to continue to pay people's salary when they're at home for that 12-week period. We would still encourage you to work with the organisation to see what work you can continue to do while you're off, whether that be your own job or another role that you're able to fulfil whilst you're working at home. And we'd also ask that if you have any unused annual leave that you feel you'd be able to take to contribute to your pay over that 12-week period, that you should do so. But we do want to do all we can to try to reduce the personal and social and economic impact for all our staff. So that's it from this week's coronavirus video blog. I just want to sign off by reiterating some of the sentiments that I shared in my email at the end of last week, and thank everybody across the organisation who are working unbelievably hard in the face of what is unprecedented demand for the organisation we've never seen before. Everybody I've spoken to and seen and liaised with and heard about seem all to be going above and beyond the call of duty to support each other and patients at this time of need. So all parts of our organisation seem to be working flat out. In particular, our clinical hub, our broader out of hours service, so people working in respiratory hubs and our treatment centres and home visiting. Our Preston and Chorley site that is working hand in glove with the A&E department, managing all the cases that walk through the doors of that service. And some of our more unheralded back office services that are doing loads of work behind the scenes, enabling the organisation to continue to function. So just like to call out our IT team who over the last week or so have worked round the clock to purchase extra equipment, configure systems, set up some quite complex new ways of working across the organisation that have enabled us to transform what we do, both face to face and also over the phone, and to enable people to work remotely. And also just individuals who have gone over and above their normal roles just to do what's necessary has been really humbling. So for instance, Brandon, our finance assistant, has been making trips to IKEA and drilling boxes to enable us to put laptops in that can be distributed to people across the organisation. So I just want to thank everybody individually and collectively for all the efforts that you're putting in. It really is appreciated. If you've got any questions or if you've got any concerns or queries, please don't hesitate to speak to your line manager, contact me directly, or get in touch with Anna in communications, and we'll make sure we answer your concerns as quickly as we possibly can.